Well, as we mentioned, the UK has recorded the highest number of new cases since the pandemic began. Another 33,470 people have tested positive for COVID in the UK. That's a rise of more than 10,500 from yesterday's figure. It comes as a large study has found that the UK's coronavirus outbreak is continuing to expand rapidly. Imperial College London has found that more than 1 in 80 people in England now has the virus, compared to 1 in 170 at the start of October. Our technology correspondent Roland Manthorpe is with me. So, Roland, a large rise in cases, but tell us more about these figures you have from Imperial College.
Yes, so Imperial College has got a really big, influential study. They tested 160,000 people between the 16th of October and the 2nd of November. And looking at this data, it's a bit like watching a movie where you know the end. We all know how this ends up. We all know that we end up back in lockdown. But it gives us a sense of the plot of what happened leading up to lockdown. And it is incredibly interesting. So we started off, and as you were saying, there was a very big rise in mid to late October. The virus was doubling, and almost 100,000 new infections were happening every single day. Then the researchers found things plateaued off a bit right up until the end of October, and this is when things get very interesting. The scientists found that right across the country there was a sharp little uptick just before we went into lockdown, and we had a briefing call with them earlier, and it was put to them, was this expectation of a lockdown sending people out to the pub? And they said they couldn't be sure, but it's quite possible that was the case. We've been hearing all day today and all day yesterday about Lee Kane, the Prime Minister's chief spokesperson, and his shock resignation, reportedly because of tensions because of that leak. It felt incredibly significant at the time, but now we learn that that leak, which put news out about lockdown before it's ready to be announced, may have also caused a spike in cases going into this lockdown, which could help explain why, as we heard today, cases are still at a very high level. It felt like an incredibly consequential moment at the time. Now we learn that it was perhaps even more significant than we thought.
Yeah, interesting stuff. Roland, thanks very much.